Good morning. I hope everyone's having a great Monday. We certainly had a nice weekend recovering from the storms. Thanks for coming in and taking a moment to spend some time with me so I can give you an update on the university activities. This is our first time back to doing this since June. And there's a lot that's taken place. And in fact, we have meetings on a weekly and almost daily basis. So it's sometimes hard to remember that I need to come back and share some of the information that we've not shared broadly since June. The good news is our students are all back. We have 182 medical students, 51 pharmacy students, and a record 68 graduate students at the university. All of them are back in their seats, engaged in classes and study, have the opportunity to meet with many of them, and they're all thrilled and excited to be here and noting what a good time school has been so far. We hope to keep it that way. We've also gone through 2 white coat ceremonies for the College of Medicine and the College of Pharmacy. Sandra and your team, thank you very much for doing a great job with those also. I do want to pick a couple of topics today that I've had a lot of questions about, and rightly so, because there's a lot of dynamics that are changing around higher education, both nationally and within the state. So one of those that I think is really important that we discuss is diversity on our campus. We made a concerted effort to focus on NEOMED having a diversity reflective of our state community, of our taxpayers, because we are indeed a state-funded institution and a public university. And we've made incredible progress over a very, very short time. Our College of Medicine is at about 20 to 22% in total. Our College of Pharmacy, about 17%. College of Graduate Studies had some great variability, but last year it was in the 30s. This year, I believe it's somewhere around 16%. And the state of Ohio's diversity is at about 16%. So we are there. We've done a really incredible job. When I say we, it's you, our team of experts who've led the charge on making this happen. A lot of concern, and I understand it, around the Supreme Court's decision around affirmative action. We are no longer allowed to take into account race or ethnicity when making decisions for who will come in and be recruited to the university. And we do know there are state activities taking place around the same area. We've had a team of experts led by our academic teams, as well as Maria Scheimer in general counsel. I think we're in a good place. What I've heard is you're not going to hit the mid-20s anymore, but we think there will be a few percentage point fall in our underrepresented minorities coming into the university as a whole, but that we should still be able to hit our target goal, which was to have a diversity at least as reflective on this community as it is more broadly in our community in Ohio. We've looked at some really standouts in this area. So California has had an elimination of affirmative action for over a decade now, and the number 3 most diverse medical school in the country is University of California, Davis. They've managed to do it. We'll be able to do it. Our goal is to continue doing what we have done so well, but doing it within the confines of both federal and state law. I know our team has created a really better holistic approach at how we'll look at admission, and they are very much compliant with the way we need to operate. So we'll be there. We'll be fine. Fortunately, we have experts who know how to lead us through this. I do expect that given our current enrollment, which was not shaped by SCOTUS because it predated the Supreme Court ruling, is very likely to take this number 41 in the country number, and I'm hearing drop it down to as low as the mid-20s to 30s. So we'll continue to see significant progress as the diversity of this campus has continued to expand. And as one of our students shared with the Board of Trustees, who is herself an underrepresented minority student who went through our MFM pathway and is now an M1, she feels completely at home on this campus. She has experienced being a student at universities and not feeling that warmth and that welcomeness and that feeling as though she's part of the broader campus and fully supported. but says 100% her experience in NEOMED has been that. And that's because of you. And that's because of those of you who are not here today because you're out teaching with our students or your support staff who's helped us get there. So thank you all for making this a campus where people feel welcomed. This is really great news. As part of our UH partnership, Northeast Ohio Medical University was asked to be on the renewal grant through CTSA. It's termed the Clinical Translational Science Collaborative. It's run by Case Western Reserve University. Dr. Boffman has been our representative leading the charge on this. We learned about 3.5 weeks ago that the grant was renewed at $1 million for 7 years. That makes NEOMED an equal partner. Although the grant is run out of Case Western Reserve, the new collaborative is University of Toledo, Northeast Ohio Medical University, Case Western Reserve, University Hospitals, Cleveland Clinic, Metro, and some elements of the VA health system here. They've renamed it North Ohio CTSC. What this means for you as faculty and the faculty of our partner institutions like Akron Children's and SUMA is there will be a lot more research support infrastructure available to you to apply for. It's really meant to be a benchmark type program run by the NIH so that we can get access to more data, more partnerships, access to research support such as biostatisticians and informatics. So Dr. Boffman and Dr. German will be putting together a slide presentation to be able to share with you what this means for you, what you'll have access to, how this is going to improve research collaborations across the state. This is a really big deal. $56 million is a lot of money, and it's for a 7-year period of time. We would expect we'll continue to ride this trajectory on their next renewal. The key with the renewals are you keep moving along the progression from initially early stage research to fully translational research. The NIH really wants to see that the dollars they're using to fund medical research result in impact and change in the lives of actual patients. And that's the reason they fund the CTSA. They felt like in the past, that progression wasn't occurring the way they would have liked it to. They see NEOMED as a critical partner for our areas in rural, urban, and social determinants of health. That is the big focus of this particular grant, in fact. So this is going to be great. I'm excited about it. Our partners who teach for us, so Akron Children's Hospital or SUMA, for example, in addition to others, as long as they come through NEOMED and apply for resources, access, and assistance as a NEOMED faculty member, will also be able to fully engage in this. They can't do it separately as an Akron Children's employee, but they can do it through us. So I think this is going to be really big for our institution. You're going to see a lot on this. They've asked us to get a lot of press on this. I've already received a lot of accolades and letters of congratulations from around the country for being part of this. I think this really helps put us on the map. I do want to recognize our talented researchers here at the institution. Just since January 1st, I actually think the number's more like July 1st, certainly July 7th, we've received notice of over $4.1 million in funding from 7 faculty members. So this really puts us on a good trajectory this year. And those members I do want to recognize is Dr. Sheila Fleming, Dr. Leah Yin, Dr. Eric Messamore, Dr. Harry Civic, Dr. Stacy Behringer, Dr. Yang Lu, and I am forgetting one and I have to cheat. So my apologies. How could I forget? Dr. Jesse Young. So congratulations to all of you. When you get these type of awards, this is an outside body saying the work you do is outstanding and valid and important. So this also helps put NEOMED on the map because of you and the work that you're doing. So thank you. This is the one piece of the presentation today that's not on the positive note. It's more of an informative note. All of you know that we receive our health insurance through Summa Healthcare. And I don't expect that you can read what's up there on the slide is to remind me to talk to it. We've been very fortunate and have kept flat insurance rates for 2 years, and we are protected all the way till end of December 2024. So in almost a year and a half more. I just want to get people used to the idea that once it goes beyond, so we're into January of 2025, it may seem like a long ways away, but the way we are utilizing healthcare, we get feedback from our insurer. You can see that our orthopedics claims are up 38%. That pharmacy accounts for 40% of our total cost of care. Emergency room visits up 30% and urgent care up 20%. Now, if this is how you're getting your care because it was needed, that's great. That's expected. That's what we want you to do. But I'm trying to put the power back into your hands as to what happens after end of December 2024, what happens to your rates and your contributions to your paycheck. If you're using emergency rooms and urgent care as a primary care pathway because it's easier, or you didn't want to wait for an appointment, I know that's not the majority. Start to rethink it. Otherwise, we know what's going to happen. We'll know by July 1st of 2024 what's going to happen to our rates. Talking to Mary Taylor, she thinks we could see a jump as high as 20%. And that becomes a really, really large number. So all I'm going to do is periodically, as we get information, is share it with you. If our rates go up, we all pay more. I would like for us to figure out how we try and contribute and control this. And as the numbers up at the top, what they show you is the amount of money that is being spent by Summa Care is greater than the amount of money that we are giving Summa Care. And as long as that continues to happen, that we know they're going to raise our rate. So I just wanted everyone to be aware. This is purely an informational slide. And so all of us can work to try and control this, maybe, or maybe these are just completely valid and we're doing everything we should be doing and healthcare is going up and we should expect those increased costs anyway. But it's a little ways away. I just wanted the team to be aware of this. The last update was, I believe, before it was before the state of Ohio legislature determined what the state budget was going to be. And we had a lot of things we were speculating on at that time that affect how we run operations. We were hoping for a 3% increase to state support year over year. We didn't get that. We got, instead of a cut, which we were expecting, we ended up getting a 1% increase year over year. So definitely not keeping up with inflation, right? We know that inflation was somewhere around 4.8% from June to June. So this means we really are operating on less dollars into the year because the cost of running operations is higher. Good news is, through the efforts of Senator Serino and Representative Pavliga, we got $4 million for the dental college. And those $4 million were front loaded into this fiscal year, 2024. So that's going to be a really good thing. With this, the previous $1 million from the state, $2 million from the federal government, and about $11 million in philanthropy, we've hit our target for the minimum we really needed to get for the College of Dentistry to really take off and to excel. So this is really great news. And we do want to thank our legislators who've helped us out to be able to get these dollars in place. But $4 million is a big deal. That is not something that most universities got. So they did recognize the value in what we're doing and the value in starting up a dental college to help address the oral health problems in Ohio. I do want to recognize Dr. Feng Dong. He got the M1 Teacher of the Year Award. For those of you who look at Pulse, you've already seen this, but not everybody does. So I wanted to highlight some of the great things and the accolades for our faculty and staff here. I also want to recognize Dr. Canal Amin. For those of you who know who Canal is, he's a faculty member in the College of Pharmacy. He started and has been running Neovations LLC, which is a pharmaceutical consulting program run out of the university. He's grown it. It's doing well financially. has shown his business savvy and understanding healthcare delivery platforms. So we have now moved him into controlling all of our LLCs from an operating perspective. So he is now the Chief Operating Officer for NEOMED Health. So while he's continuing to grow Neovations, he has now stepped in and is working on operations for our clinic, streamlining it, making sure that we're focusing on a sustainable enterprise and one that's delivering outstanding patient care. Just as a reminder to everyone in the room, if you do have our SummaCare insurance, there is no copay for you or your covered family members if you go to our clinic. Our clinic, during the surveys that were sent out broadly across the university, received just an outstanding evaluation. Nobody gets a 10 out of 10. They were roughly 9.7 out of 10, which was the highest rated of any program at the university. Lots of accolades for our physicians, especially Dr. Boltrey, Dr. Whipke, and Dr. Bond. Our nursing staff, our administrative staff, all recognized also. Our visits to that clinic are continuing to elevate. I believe we were close to 290 visits last month. We have capacity for about twice that. So we're continuing to grow and reach out to the community. And as a reminder, Dr. Amin would be upset with me if I didn't remind you that they do have a full supply of the new flu vaccine. So if you would like to get it, it's available up there. And then the other thing they're expecting, even though they have COVID vaccine boosters now, it'll, in a period of time, once it's finally released, we will get the new variant available for everyone if they choose to get that. Want to recognize Dr. Sebastian Diaz. Dr. Diaz was recognized by the Cleveland Press Club. He had written an article on diversity elements, including our culture, our community in Cuba, receiving the second place Multicultural Writing Award. So congratulations. And then, of course, our own soon to be keep saying Dr. Appelman. He will be a doctor in about a year, I understand. But he was recognized, and this is very prestigious, to be Greater Akron Chambers 30 for the Future Award. So congratulations to you also. And we have a new trustee. The Board of Trustees is composed of 9 full-time trustees who have a nine-year commitment. And then we have 2 student trustees who are also appointed by the governor. And so we have our newest one. It's Omar Ashraf. He is, my goodness, M3, sorry, an M3 student. So he'll have 2-year term on the board. We're really excited to have him. He was a great participant in the last board meeting. And you know, we run the Vitals program. Our next Vital speaker is September 14th. It's Dr. Dan Simon. I'm going to ask all of you, if possible, to do me a favor and attend this. This is really important. Dr. Simon is the key person working with me to develop the UH partnership together. And there are some really big things that are about to come our way. We're waiting for a September 23rd meeting at UH. And after that, we're hoping to release some information on a huge investment that will recur for us. One of the things that they're looking at doing is sponsoring the Vitals program and growing it pretty significantly. So Dan has been really key. We meet with him at least every 2 weeks, oftentimes more frequently than that. They are fully committed to doing some really amazing things for us. We are not second-tier partners with UH, much like Summa and Akron Children's. They're bringing us in at a really high level, and the things that we are going to benefit from it, including this year, we hope to be able to talk about those by the end of September, will be massively beneficial for the university and put us on a really great trajectory. So if you're able to attend, I ask that you please do. September 14th, we run these at noon. I don't know yet whether this is in person or by Zoom. It is in person, so it'll be right here. And of course, we will supply food and beverages for that. If you could please come, that would be wonderful. And encourage your students also. Reminder that September 7th is the Backyard Bash over at the Village. There are 170 students signed up for this, but this is open for alumni and faculty and staff. There's music, there's food, there's drinks. We'd love to have all of you come out and to support our students. The Backyard Bash is fully funded by 3 alumni, I understand, who've put up the dollars to be able to do this. I think I got that correct. And then the news, as all of you know, the Board of Trustees allows me to extend extra days off to a well-earned faculty and staff in December. So woe is the president who does not give those days out typically, right? I don't need anybody leaving bad notes on my door. So apologies, it took us a little longer this year to get this out than typical, but we are awarding the extra days in winter breaks, the 26th, 27th, 28th, and 29th. You're encouraged, if you choose to do so, to use vacation or comp time the week before that starts, because the university will be on really minimal operations. Just remember, thank those who stay back and manage this university. Well, many of us get to go off and take some time during the winter break, especially our campus operations team and in the very back of the room, because that's where a police officer would sit. Yeah, we have a couple of our folks in blue back there. They have to man and staff this campus. So while you're off and celebrating and having time with vacation, somebody is here managing this campus and looking out for the. Please don't forget to thank our campus op team and the police force who comes in and protects and manages this campus for us. All of you know that in November, I think at least we hit the 50th year of our charter. So we are moving into our 50th year anniversary, our golden anniversary. We're expecting to see lots of events, both from our campus team, but as well as the foundation team. Many of these will be bringing in alumni engagement so that we can celebrate together 50 years. 50 years is a big benchmark for us. And we are about three years away, actually, this October, from an event where we're going to bring everybody from campus who's interested. We hope a great deal of you out to our main administrative entrance, where you see that sign, that placard in the cement that says 1976. There's a time capsule back there, and we will be pulling that out and unveiling what was left to us to look at 50 years later. Unfortunately, I don't believe there's a survivor who was part of that initial event, so it'll be very interesting to see what here with us. So thank you for your time. Welcome back to campus. For those of you who took a break, our students mostly did. We're really running back into high speed, high activity, and it won't be until May when we launch another class across the stage and have a little bit of preparatory downtime again. But thank you all for everything that you do for us. And now I'm going to open it up for any questions, either from the audience or from our Zoom participants. Anything here in house? Wow, silence, quiet. And I don't see anything online either. Well, did you have something? Oh, I thought you saw your hand go up. Okay, well, thank you, everyone. Yes. Okay. I have to put on the readers to see that. Sorry, that's. Okay, so how much was missed? Yeah, we'll put the recording up if part of this was missed. There was quite a bit discussed. And okay, great. Well, thank you, everyone. I really appreciate your time today. We had built out over an hour for this, so get some coffee, stand outside, chat, and spend time socializing if you'd like.